Hello, thank you for considering Paramount Bed USA as a potential partner to help you with your patient care needs. We appreciate your hard work, your dedication, and all you do for patients and patient outcomes. Today we are talking about the OBTD, D stands for dual, overbed table. So if you notice, there are two legs here. It's very versatile. It actually slides over the bed instead of under the bed, where there may be obstruction from a power drive, a wheel, or the bed's frame. So very versatile, easy to manipulate and maneuver back and forth. This promotes ease of use with various beds by eliminating the potential interference with that subframe architecture or the drive or steering systems. You can position the table where you want it, not too close or too far from the patient when they're sitting up in bed. So oftentimes with other tables, you get right about here and the leg underneath gets caught on something on the bed. Whereas this, we can bring it right to the patient, and the patient is able to utilize the table for whatever they were doing, whether it's eating or something using the tabletop. Other beds, again, you have to stop it from advancing, which prevents the patient having comfort and a gap quite often. As you can see, this has an extra wide tabletop, extra space for you, the staff, as well as your patient. Additional room for the patient's things or for your things, the staff. Often we utilize tables on the side of the bed for our staff supplies. Also staff flexibility during bedside procedures because of that extra space. It's actually 15.7 inches by 50.6 inches. Nice thing about this is if you have a smaller room and you have an issue with storage of tables, this can actually just be stored at the end of the bed at any height that you would like it at. The brake function prevents unintentional table movement. It has brakes that may help stabilize the patient position while performing bedside procedures or when the patient uses the table for support entering or exiting the bed. Very simple foot brakes. Go ahead and lock that in place. As you can see, it's very stable. We want to demonstrate if you're doing a bedside procedure, have our patient lean over the table. Perhaps we're doing a lumbar puncture or an epidural or a block of some sort. Think about this, tables without brakes or the brake not locked could potentially cause a slide or present a fall risk to the patient that's utilizing the table, getting in or out of the bed or repositioning, and a risk to the staff if they're using the table during procedures. We do understand it is common medical practice to utilize the table for bedside procedures. However, leaning on the table is not recommended in the instruction manual. The auto brake function is also an option for this table. We have locking casters and an adjustable height lever with gas spring mechanism. So the actual height can go from 32.7 inches to 45.3 depending on which model. Very simple. Push down. As the provider, patient also can adjust the table. There is a raised table edge. This decreases your chance of spills off of the table. There's also a retractable towel rack here, goes in and out. And as we saw before, very smooth maneuvering of this table. Lock it. So very easy to manipulate and move around. The safe working load for this table is 66 pounds. Thank you for your time and all you do for patient care. For additional information, please contact Paramount Bed USA at 1-800-910-5703 or take a look at our website at paramountbed-us.com. Please refer to the instruction manual for safety precautions.